Get your hook and go. Forward. Hook it. Get around, PB. Go now, go now.
Life before cancer for me, heavily involved in surf lifesaving. Very fit, very active. Rowing surf boats, patrolling on the beach on the weekends. 2 children, mother of 2, and working at the hospital in cancer, in oncology. I was actually overseas on a family holiday when I had my diagnosis. We were in Como, beautiful town in Italy, and it was our second to last day. We were heading home back to the airport, and Mum unfortunately fell down some stairs, 2 flights of stairs, head first, and she fractured both arms, fractured her face, and it meant that she wasn't able to fly home because of the facial injuries to her. On the day she went in for her surgery, I dropped her into the hospital, went home to the hotel, had a shower, and I think for all those women out there, it's so subtle and so simple, but I was just putting deodorant on, had my arm up in the air, and I looked in the mirror and I could just see a little dent, and it was smaller than my little fingernail, just on the skin. And I went and sort of felt it and immediately felt a lump. And working in oncology, I knew kind of straight away, I just went, oh, that's not good. From there, I was really lucky. I was able to contact my mum's surgeon in Italy. He organised imaging, ultrasound, mammogram straight away. So within a couple of days, I knew the diagnosis. And I was organising to get back to Australia, see the surgeon and have a biopsy to confirm what was going on. So yeah, it was a little hectic and I'd say a little overwhelming at the time. Working in oncology gave me that assurance that I knew what to do, and I think unlike probably most other patients where you get that diagnosis and there's that huge fear of what's going to happen, I kind of knew what was going to happen, so I didn't necessarily have that fear. Let's get home, get the surgery, and I knew the pathway then what I needed to go on once we had the biopsy results. So yeah, it was a interesting time being overseas and not having your family there, only my mum who was in hospital. Yeah, but stuff happens. From the biopsy, they determined it was grade 2, which means that the tumour's growing, it's kind of jogging. So it's not sprinting, but it's not walking. So you got 3 grades. Mine was sitting in the middle. However, I could see the tumour growing. So it was very superficial, it was very shallow, and I could actually see the white beneath the skin, and I could see it growing. So then I contacted the surgeon, we went in, had a look, and she just said, no, we're doing surgery sooner. So she went in and took it out, and it was then post-surgery that when we got the results pathology back, that it was a grade 3, so it had been upgraded. I'd had some lymph nodes removed, but fortunately there was a few tumour cells in one of the lymph nodes, but not enough to be node positive, so very, very lucky. With my age being, I guess, younger in the sort of, I'll say low 40s, I was 44 at the time, and having a tumour that was larger than 2 centimetres, it had vascular invasion, and then I had those lymph nodes as well. It meant that my pathway was going to involve some chemotherapy. I knew it was going to involve radiation post-surgery. The type of tumour was being fed by hormones, so it was being fed by estrogen and progesterone, which is what was helping it to grow. So I knew then that I'd also need some hormone suppressants, some endocrine therapy following to manage my body until I'm in that natural state of menopause, because I could be 10 years away from being in menopause naturally. They need to then keep your body in that state of menopause using medication. So that was my pathway, and surgery was that first step. I work in oncology. I had actually been here, it was smaller in its initial stages, but I did a site tour here to have a look at lift, and my background is personal training and coaching and fitness. I used to work in the Sassy gym doing programming for athletes. I've always had a bit of a passion in that space. I've always advocated for exercise with my patients at work to stay mobile and fit and active. I knew as soon as I got diagnosed that I would be coming here. So I already knew that that was the pathway that I was going to take. I knew I needed to do supervised, even though with my skills and my knowledge, you've got a lot going on in your mind and you need someone to guide and direct you. I made that decision very early on, even before surgery, and I came in and had a meet and greet and spoke with the doctors here and met the EPs prior to surgery. So I started here 2 weeks after surgery. The evidence and the research is based around increasing or maintaining your bone density, keeping your muscle mass up. We know that when you're on hormonal medications, when you're on chemotherapy, that your body can waste away very easily. It doesn't take a lot, and so you have to be actively engaged, but it needs to be following those protocols that have been developed and designed and trialled and been researched. So that's where that prescribed program comes in, because you've actually got a very specific goal in mind, whether it be increasing or maintaining your bone density or whether it's muscle mass. You've got to do a set amount of exercise at the right intensity and the right type of weights to achieve those outcomes that have been researched and studied. Started 2 weeks after surgery, so went straight into it. And so I was already doing it before I got to my chemotherapy, so I had a little bit under my belt before I got there. I was coming 3 times a week. Having that underway before I got to the chemotherapy meant that I was already in that mindset, and it was one less hurdle to tackle while you're on chemo. I got into the chemotherapy, and doing that exercise and having that routine, it's good for your mental health, but it also helps you manage your side effects. And for me, having that freedom to exercise and train right through, I really did almost everything that I would normally do, albeit not at the same capacity or level. But I was able to still row surfboats. I competed in state titles while I was on chemotherapy. I was able to do the things that I love doing and able to keep doing them. Yes, I still had days where I was flat and I was tired, but doing that prescribed exercise medicine, it gave me that huge hit of endorphins, but it also allowed me to tolerate my treatment a whole lot better as well. When you come to lift, it's a holistic approach. You can't just roll in and crack into your exercise. Because of the type of treatment you're on, some people are on a lot of different medications. They need to monitor that they're actually fit and able before you go into the exercise medicine room. On coming to lift, each day you'll see a doctor prior to. They'll just check on your general well-being, and they'll go through regular indicators to make sure that you're good. So they're going to check your blood pressure, they'll check your fatigue levels, they'll do some symptom tracking on you, and they do this each time, so then they can also see trends as well. If you're coming in and they notice that your fatigue is starting to increase or tingling in your fingers, they might recognise neuropathy, all of those symptoms that may escalate while you're having your treatment. The important part of the doctor is to make sure that before you head into that space, you're in the right mindset. You might also just be not having a great day mentally, and you're just really fatigued and you haven't slept well, you're really tired. And so they can moderate the exercise plan and customise it to you. So when they take you through from seeing the doctor, they hand you over to the exercise physiologist, do a handover with you there, give a quick summary of how you're feeling today and what sort of exercise they're recommending based on what you've fed back to them. And then at the end of your treatment as well, you will see the doctor again. They're checking that the EPs have worked you very hard, but then your blood pressures come down, your heart rates come down, and you're stable and able to walk out the door and get in your car and go home and be safe. Outside of the exercise medicine room at Lift, I accessed other services. Everybody's journey is a little bit different and what you need. For me, I've got breast cancer. With the breast cancer comes instant menopause with chemotherapy. They put you into a medically induced menopause. For me, there was that risk of my pelvic floor getting weaker because I don't have the estrogen anymore to support your pelvic floor health. And then that leads on to bladder leakage and urinary incontinence and all those lovely things that you're at risk of getting as you age. And so I'm very proactive in my health and wanted to manage that ahead of time. And so I saw one of the doctors here and she referred me to one of the physios who does the pelvic floor assessments. She was amazing, incredibly thorough. I walked away with a plan that I could then work on to maintain and increase my pelvic floor health and make sure that the medications that I'm on aren't going to have an impact on my life where I'm not able to do the things I enjoy doing. I accessed physio. Early on in the journey after surgery, I had lymphedema screening because I'd had those nodes removed from the axilla. That was always a risk. And during chemotherapy, they did have trouble getting access on my left arm. So they did end up accessing my right side, which is not preferred when you've got lymph nodes removed from there. So having that baseline data also was really important. As I progressed through treatment, I could then, if I noticed things weren't going right, we could then reassess, re-image, rescreen, and then know where things were going and then what to do. And I also access the nutrition services here as well. For me, it was that anti-inflammatory diet, so just some little tweaks that I could make to my diet to make sure that I was in the best position I could be in while I was on chemo and staying healthy. If you asked me what my biggest challenge is in this whole journey, it's that post-treatment phase. I work in the acute setting. I understand it very well. I have really good resources and supports, as most patients do. But when you hit that post-treatment phase, you lose that safety net and that team around you. So you've had oncologists, radiation oncologists, you've got surgeons, and all of a sudden you're discharged from those services, so you don't have access to the nurses. And there's still side effects that happen that for my chemotherapy nurses that I work with every day, they weren't even aware of some of them because they don't actually see patients in that post-treatment phase. So my fingernails were going black and they were falling off, and the nail beds were detaching, and my toenails were doing the same, and I had a huge amount of lymphedema and just fluid retention all over. I think I had about 2 kilos of fluid on. I looked horrendous. They were my biggest challenges. Being fit and active is something I've always done, and it was really challenging. I found it hard to go for a walk, going up the stairs because of your fatigue. That post phase was probably my biggest challenge. I had to really lean into the knowledge that I've got professionally to find a roadmap back to health, and I think I'm on it now. I think when, if you'd asked me 4 or 5 weeks ago, I would have said I'm at about 30%. That's starting to turn quite quickly, and I think that's because I've been able to get a holistic approach to my recovery. I've got a team and I've got a set plan going forward, and I've been able to tackle one thing at a time and start to build each little part back up. I've got eyelashes now, which is amazing. And I've got hair, albeit horrible. I think I'm at that fuzzy tennis ball stage at the moment. I'm back in the surf boat, back training with the girls. With the surf season starts, we start patrol in a couple of weeks. Life goes on. There are some things that pop up every now and then. I'm noticing that my chest wall, that my muscles in my chest from the radiation are starting, they feel like they're all knotty and sort of fibrous. Increased pain that you're not sort of expecting. The fatigue is real from chemo. It's bone deep. You're so tired that you lose your motivation and you lose your willpower. So it becomes very difficult to motivate yourself and drive yourself. And so that's where it's important to have that team around you, but it's a clinical team. You can have your family and your friends, which are great, but you do need that clinical team to sort of pick you back up, give you a plan to get back together, and then I guess deal with all of the spin-off side effects that you're now having because you're on medications and they're causing other things within your body. So it's just learning how to manage your body, your new body going forward. Walking on the patient side has been really different. I'd almost say it's a privilege, which sounds weird, but it's a very privileged position to see it from a patient perspective. Not everybody gets that opportunity. I now have a better connection with patients at work. I can completely understand what they're going through and what they're experiencing. It has given me a completely different perspective and a different appreciation for what patients are going through. While it's not something you want, it's a privilege, and it's been great for my job, and it helps the patients going forward. When you get diagnosed with cancer, all of a sudden everyone around you is getting diagnosed with cancer. So it's been quite a lot of women my age have been diagnosed while I've been on my journey. Some of them very good friends, and so they've reached out knowing that I work in the space and that I'm on that journey. And one of the first things I say to them, have you been to LIFT? Because it really makes so much difference. I can't sing the praises loud enough of being fit during treatment. It makes it journey a little bit smoother, a little bit easier for you. The really nice thing about the model of care at LIFT is that it treats the whole person. They're not just treating your cancer, they're looking at everything that's going on with you. They've got all the services that you need to pick you up and put you back together at the end. And all the services are here together under one roof, so it's accessible and it's easy to get to, and you're not having to go to a million different clinics all over Adelaide.